it's me, Ari from Stoked to be the Stokes with some more info to know before you go. So as you know, maybe you've been paying attention to the news or social media, there have been so many stories of the rising statistics about maternal deaths during and after giving birth, right? A little bit scary, especially if you're an expectant mom or a new mom. So one of the things that I wanted to talk about was how to advocate for yourself, because advocacy is really the key to solving this problem. Advocacy and being informed. But a lot of people don't talk about what does that look like? Advocating for myself? Do I have an advocate? What is an advocate and what do they do? So one of the first things that I wanted to discuss was how to properly advocate for yourself in the hospital environment. Newsflash, it actually starts before you get in the hospital. From the minute that you meet your OB, you want to start asking questions. As I talked about in another video, you want to discuss things that are concerning for you and see how they relate information to you. Is it a way that makes you comfortable, or do you feel like you're being brushed off? Those are important things to notice before you're in the throes of labor with your OB provider. One of the things that is also important is having someone who can advocate on your behalf in the event that you have not had any of this practice, but you find yourself in the delivery room feeling a little bit uncomfortable. This could be in the form of a friend, a family member, a doula, or even your nurse. Me as an L&D nurse, I love advocating for my patients. I can tell when they're feeling scared, uncomfortable, or even just confused. And I like to be able to answer questions or ask them to the provider on their behalf. So be sure that you're utilizing the people and resources around you. Another thing I like to tell people, which might not be such a popular opinion, is don't be afraid to fire folks, girl. What does that mean? Basically, in the hospital setting, we as nurses and providers are here for you. If we're not doing something right, if we're not meeting your needs, you have every right to request another provider. That goes for nurses, that goes for doctors. Don't wait until you're taking your post-delivery survey to report anything that makes you uncomfortable. There's levels of management that you can speak to, from the charge nurse to the unit manager to the unit director, and your concerns will be heard and taken seriously. If not, you can always go to the next level. What does firing someone look like? Well, as I've seen from other patients, it means, can I please request another nurse? I'm not feeling comfortable with how my care is being managed. Now, of course, if you're like me, you might sometimes wonder, well, what if they talk about me in the nurse's station? What if they say, oh, she's being difficult? What if I get the nurse I fired friend and now they're having conversation about me behind my back? Well, what if you have the birth experience that you don't want and you're traumatized about birth from that point forward? These are things to think about because the long-term effects are only going to stay with you, okay? So, asking for another provider, no harm, no foul. This is a once-in-a-lifetime opportunity specifically to you, and you're the one who's going to leave with the memories, good or bad. Another thing that I advise is asking questions. Don't be afraid to ask questions in the office or in the hospital setting. Usually, I ask questions to see how a patient is understanding their care, and I love when they ask me questions. Sometimes it's easier to ask the nurse questions. So if you're not comfortable talking to the doctor, or maybe they're in and out because they have to go to an emergency, feel free to say, hey, could we go over a few things, or could you have the doctor come back in here because I don't think I understand exactly what he or she was saying. It's always good to take advantage of the time that you have with your provider. Don't be afraid of taking up too much time or wasting their time. This is your care and you're a part of the medical team. Another thing that I would suggest would be to make sure that you are being persistent without being pushy. Of course, kindness is the answer to a lot of doors opening. So you want to make sure that even if you have a birth plan that's very detailed, even if you have very specific requests or preferences, you want to make sure that you're presenting them in a way that is respectful, kind, courteous, but again, persistent, so that everyone on your team knows what your desires are. That way, if you do hit a moment where you're not able to communicate the way you'd like, there will be people who say, oh, you know what, she did say that she didn't want a lot of lights on, or she did say she doesn't want any pain medication, so don't offer it, she'll ask if she needs it. Things like that are important. So again, use the people around you, like the nurses and staff. Also make sure you're not afraid to speak up and fire someone if you have to. Be sure to ask questions, and again, be persistent without being pushy. If you can think of any more tips that worked for you or maybe for someone you know, feel free to leave it below in the comments because we're all in this together, right? A community trying to help each other out. Let me know if there's any other questions you guys have that I can do some more videos because I love talking about this kind of stuff. Until next time, guys, see you later. Bye.